Really happy to be here. I work at Vancouver Coastal Health, and the part of coastal health I work in is public health and population health, and that's looking at what makes and keeps people well, and what are the kinds of public policies that support that. So that's the lens I'm going to be bringing today, and what I hope to bring as a tool for you folks as you move forward in the process, so that you can really look at the community through a health lens. So what I'll do in this very quick slide through what is massive amounts of evidence, data, and approaches is just try and give you a flavor of what's available to kind of think about as you go through this. The work that we do isn't so much at a neighborhood level. We're looking at fairly high-level concepts, but we'll show you that as we go. Public health is about improving the health of all and reducing health inequities. So often the decisions we make to improve people's health and well-being, if we look at it at a universal level, that's really important because you reach the most number of people. But it's really critical that you also look at reducing the inequities. And often if you only look at the universal, you end up exaggerating the gap between those with the poorest health and those with the best health. So when you do your considerations, remember to think about improving health of all and addressing the inequities. And they require often different strategies. Oh, I didn't say the second piece of this is we've got a lot more evidence. Health, that what determines our personal health and well-being, they've divided up into areas, and about 20 to 30% is your health services, access to good health services. These are critical. All of us have experienced that to greater and lesser degrees. We need our health services. But 60% of our health is determined outside our health care system. So that's where we live, how we live, what we eat, our physical activity, our housing, our jobs, all of that is what really keeps us well. And so that's why we're here talking about this. Public health has had an interesting path because public health started at the same time community planning did, really looking at issues of infectious disease and sanitation. So it was really looking at the water, sewage, pest control, that kind of thing. And that had such a huge impact prior to antibiotics. That's when our life expectancy shot up. It's the public, so again, it just sort of demonstrates that link. The last, through most of the 20th century, we've been looking at immunization, disease prevention, and injury prevention, safety, seat belts, helmets, and tobacco, which actually fits a little bit more in this one, but that's our precursor, looking at a more comprehensive view around keeping us well, looking at the environmental as well as the individual factors. So the 21st century, what we're realizing is the big driver of our healthcare costs right now and many of the issues is chronic diseases. And these are diseases that are about 80% preventable through our lifestyle and the environments that we live in. Very often the tendency has been to say, okay, well, you've got to do your 150 minutes of moderate to vigorous exercise a week. And if you don't, well, you just need to pull up your socks and really get out there and do it. Or you need to eat your 6 to 8 fruits and vegetables. And forget the context that people are making their life decisions on. Their day-to-day decisions depends on the context and what's possible. I'll just do a couple of very quick sort of disease prevalence slides, but it's basically chronic diseases are going up. This is diabetes over the years. You can see it. It's very typical of many others. This is from obesity. As obesity has gone up, you've heard about that, obesity and overweight. And with that, there's a whole host of other diseases, diabetes, hypertension, coronary heart disease. They're all going up substantially. And it has been said before that this may be the first generation that we're raising now that won't outlive our parents. We've been on a longer and longer life expectancy, and that may be curving down. It has an impact, of course, because our healthcare costs keep going up, and that reduces what's available for all the other important things that we are concerned about: our education, housing and social development, support for children, forestry, environment, and citizen services. So chronic disease really is a big deal that we really do need to get on top of. The other thing that's interesting is with this one table, the brown bar on the left is socioeconomic status. So what these do is it goes through all of these different diseases, which you probably can't read that well, but from anxiety to diabetes to unintentional falls, injuries in children, mental health, heart disease, that there's a very predictable grade between the highest income or socioeconomic status, largely determined by income, to the highest. So the highest has got the small, that's the black, and moves up. So recognizing this isn't about personal choice. It's about the... So the way we design our neighborhoods can play a significant role in encouraging community members to make healthier choices and decrease the risk of chronic illness. So what aspects? We've been doing a lot of work in the last 5 years. This is really a growing area across Canada and internationally. The health, how does health intersect with the built environment? What do we know about the evidence that connects that? So I've been part of a working group, a provincial working group that's put together a document called the Healthy Built Environment Linkages Toolkit. And what's new about this toolkit is that it actually goes from what are the planning principles, what are the health impacts, and what are the health outcomes. So we ended up identifying 5 key planning elements. We called them from neighborhood design, housing, food networks, natural environment, and transportation. And this is the only one I'll go through with this level of detail, and my slides are available for anybody, but the toolkit is really where you'll get this more effectively. Is we listed what are the elements of neighborhood design, sort of the overall mix and package that impact health, and how does it do it? So the 5 ways that were identified, and this was based on a literature review based on very, quite a rigorous evidence review, was to enhance neighborhood walkability, create mixed land use, build complete and compact communities, enhance connectivity with efficient and safe networks, and prioritize new developments within or beside existing communities. So, and then what we took is, so if you take number 3, build complete and compact neighborhoods, we said, how does that impact health? Or what's the impact of that? Is it reduces the number of vehicles traveled, the ambient air and water quality will go up, transit use up, heat island effect down, exposure to air pollution, not sure, could go either way. Physical activity up, cycling and walking can go up, and density up, which allows that greater mix. So the related health outcomes from that, based on the evidence, are reduced unintentional injury, improved mental health, decreased mental illness, body mass index down, obesity down, and premature mortality down. So that's the kind of evidence that we've done on each of these 5 areas. So then we walked through each of them. The transportation networks enable mobility for all ages and abilities, make it more convenient and safe, prioritize safety, increase the use of transit, and attractive road, rail, and waterway networks. So again, there was good talk about the cycling lanes and where you put them in and how do you put them in, and looking at making sure that we're going back to some of the evidence on what's happened where they have gone in and what's the impact on people's health and well-being. I'm not going to, we've got ones for the natural environments, food systems, looking at the overall food system as well as just the from grocery store to mouth, but where does our food come from? Increasing access to healthy foods in all neighborhoods, and improve community scale food infrastructure and services. Housing, this is already a neighborhood that's got quite good diversity in housing stock, but that's a really critical piece to maintain, of all different forms and types and for all age groups, remembering to look at the mix of ages who are coming in. One of the things that I wanted to say is this is a really powerful document. We're finding that people are really responding to it. There's a couple of limitations to it, even with that you should be aware of. One is that we've talked about the physical features so far, and what will be also interesting over time is to develop a similar reference book on healthy social environments. They talk about the social connections, inclusion, and so on. That this is an emerging area and it's quite complex, so it's very difficult to really, it's intended to ask the questions, not answer them at this point, particularly at a neighborhood scale. And so it's designed for your questions and consideration and to think of it that way.